We are right now less than 30 hours from the funding to run the federal government essentially coming to an end. Republicans in control of Congress are at this hour trying to come up with a short-term funding measure, while at the same time working on an Obamacare repeal and replacement bill. Chief Congressional Correspondent Mike Emanuel is on Capitol Hill to tell us where we are right now, and you're spinning a lot of plates up there. Mike, good evening.
That's right, Brett. Good evening to you. We expect the House Rules Committee to meet in a few minutes to prepare a continuing resolution to keep the government up and running and potentially health care reform for the floor. House Speaker Paul Ryan insists he is not feeling pressure to hold a health care reform vote by Saturday, which is President Trump's 100th day in office. And he rejected any suggestion today pushing moderates to support this bill could cause them to lose their seats.
The American healthcare system in the individual market is in peril right now. We have a moral obligation to prevent people from getting hurt, to stop damage from being continued. And we promised that we would do this. If you violate your promise, if you commit the sin of hypocrisy in politics, that's the greater risk, I think, to a person's seat.
The breakthrough on health care came when New Jersey moderate Tom MacArthur and Conservative Freedom Caucus Chairman Mark Meadows negotiated an amendment. It would give states more flexibility to opt out of Obamacare restrictions and, supporters say, get a handle on soaring premiums.
This affects people, and we've got to make this about people, not about politics. At every hand, we've got to remind ourselves of that. This is real people's lives that are in the balance.
Yet other moderate Republicans are not sold, including one saying it would be bad for New York.
I received no pressure. I met with the Vice President. The Vice President called me to see if there was ways that they could help me get to a yes and address some of the concerns I had. So I felt no pressure at all and have respected my position. I think part of it is because I respected their leadership and informed them before I told the public.
On the government funding matter, lawmakers offered a one-week extension late last night to give negotiators more time to finish up the funding package that will run the government through September. House Democratic leader Nancy Pelosi sounded hopeful.
I'm optimistic that we can. I always have been optimistic about it because, again, I have confidence in the appropriators want to do the right thing by the American people, and they understand each other's priorities, and they understand the limitation of resources that the competition for funds demands.
Tension on government funding right now is low. Most seem to believe a deal is in sight. On health care, those rounding up votes say it's heading in the right direction, but not very quickly. Brett?
Mike Emanuel live on the Hill. Mike, thanks.